Hey, thank you so much for your patience. We appreciate it. We realize everybody's busy, lots going on. First item is to hear from citizens present. Do we have anybody requesting?
No request, Chairman.
No requests for citizens. Okay. Next item is the approval of minutes from the executive session held on March 26th and April 6th. We have a motion and a second. All in favor, please say aye. Aye. Those are approved. Our first item is to hear a presentation and discuss an update on the U.S. Immigration and Customs Enforcement ICE 287G program. Welcome.
Good afternoon. How are you?
Very good.
Great. Thank you for your time today. And I'm pleased to introduce an introductory informational presentation that we're going to do on the 287G program. And as you know, we have an MOA with the Immigration and Customs Enforcement Agency. And with us today for the presentation is Mr. Robert Campbell. He is the 287G program manager with ICE from the Phoenix field office. And he's going to take us through a presentation just to update us on the 287G program and informational for the council to consider. So
Wonderful.
Let's turn it over to Mr.
Sir.
Campbell.
Thank you. Glad to have you here.
Thank you, sir. This meeting is, or presentation is basically to give the council and the members of the community just a brief overview of what the 287G program is. There have been misperceptions about our program over the years, and we hope that by having a little bit of outreach annually to the public, we can put aside some of those misperceptions of what the program is and isn't. We've had the program here with Mesa Police Department since 2009. It's not a huge program. It's relatively small. Part of the reason that it's smaller is the Mesa Police Department detention facility is a very short-term, basically an overnight detention facility. The people charged with more serious offenses are moved to Maricopa County Jail, and in those cases, the 287G officers at Mesa do not need to take any action, as we have ICE officers, ICE agents at Fourth Avenue Jail to handle those situations. If I could, I'd like to just go through a quick presentation that I have on PowerPoint. I don't know if that shows on the screen. There we go. Okay. Like Deputy Chief Dvorak said, I'm from the Phoenix Field Office, and I am the 287G program manager for Arizona. We have 4 programs in Arizona, the one with Mesa Police Department, Yavapai County Sheriff's Office, Pinal County Sheriff's Office, and the Arizona Department of Corrections. The ICE mission is to promote homeland security and public safety through the criminal and civil enforcement of federal laws governing border control, customs, trade, and immigration. This mission is executed through the enforcement of more than 400 federal statutes and focuses on smart immigration enforcement, preventing terrorism and combating the illegal movement of people and goods. The ERO, which is Enforcement and Removal Operations, of which I'm a part of, their mission is to identify, arrest, and remove aliens who present a danger to national security or a risk to public safety, as well as those who enter the United States illegally or otherwise undermine the integrity of our immigration laws and our border control efforts. Enforcement and Removal Operations upholds America's immigration laws at, within, and beyond our borders through efficient enforcement and removal operations. The 287G program came out of the Illegal Immigration Reform and Immigrant Responsibility Act of 1996. That's when they added to Section 287G to the Immigration and Nationality Act, or the INA. What it does is it authorizes the director of ICE to enter into agreements with state and local law enforcement agencies, such as Mesa PD, permitting designated immigration officers to perform immigration law enforcement functions, provided that they receive appropriate training and function under the supervision of ICE officers.
That's over 36,000 gallons a year! Make a difference. Take the National Challenge for Water Conservation at mywaterpledge.com. You can win cool prizes, too.
that are trained or called, working under the cross designation, and prescribes the agreed upon complaint process governing officer conduct. The agreement must be signed by the ERO Executive Associate Director and a senior political entity or head of the local agency. It provides the designated immigration officer selection and training requirements. It's all very spelled out in the MOA what's required of these officers and the agency. They must report any wrongdoing, the officer has any discipline, anything like that, so that we're aware of it. All current 287G MOAs are valid until June 30th of next year. They go 3 years on each agreement, and then we have to renew them. Copies of all the current MOAs, if anyone ever wants to see one, they are available to the general public online at ice.gov. The benefits of the program are, by working together, local and federal officers can better identify and remove criminal aliens, a tremendous benefit to public safety. One of the biggest benefits to our 287G partners is that they're able to better identify individuals in custody. The 287G program continues to receive overwhelmingly positive feedback from its partners. Our state and local law enforcement partners have become a force multiplier, allowing ICE to actively engage more officers and agents into ongoing enforcement operations nationwide that require the manpower. Prior to being delegated as an ICE Immigration Authority, selected state and local officers must attend and successfully complete ICE's 287G Designated Immigration Officer Basic Training course. The basic training program is 4 weeks in duration and includes coursework in immigration law, the use of ICE databases, multicultural communications, and the avoidance of racial profiling. This training is conducted at the Federal Law Enforcement Training Center in Charleston, South Carolina. Certified DIOs are also required to attend a 1-week refresher training course at least once every 2 years. DHS's agency priorities. DHS immigration enforcement authorities continue to prioritize threats to national security, public safety, and border security. DHS personnel exercise prosecutorial discretion on a case-by-case basis in the enforcement of immigration laws. These are our priorities. Priority 1 are individuals who pose a threat to national security, border security, or public safety. Priority 2, misdemeanants and new immigration violators. Priority 3, other immigration violators. We use our resources to effectively enforce based on these priorities. This is a little flow chart showing basically how the program works. The 287G program is only through the jail. Okay, this is not officers, Mesa PD officers on the streets. So they do not interview anyone that has not been arrested for at least a misdemeanor crime and booked into the Mesa Police Department detention facility. If an officer were to bring someone in that they suspect of being a foreign-born national and not having proper immigration status, but they're not booking them in the jail, 287G will not interview them. If they want to address the person's immigration, they will need to do that through contacting ICE themselves. It's very straightforward in the MOA that it has their authority is only to be used in that detention facility. Okay. The standard booking process in the jail, when they go through it, anyone who's foreign-born, in most instances in these programs, will be interviewed by 287G. Mesa Police Department is slightly different in that, due to the lack of resources, and it is a very busy, small detention facility, and because the people charged with higher felonies all go over to 4th Avenue Jail, there's no need for them to do it at that point, and quite honestly, there isn't the resources to interview those people. So they will let them go ahead and go to 4th Avenue Jail without going through the 287G process or interview at Mesa's holding facility. The ones that aren't going to go to 4th Avenue but have still been arrested and booked into the detention facility, they may be going to arraignment court or whatever, those people will be interviewed if there's an indication or an admission that they're foreign-born.
Quick question for you, sir. So when they go to 4th Avenue, they are going through the 280C, somebody's evaluating them there?
They're going to go through ICE criminal alien program.
Okay.
We have ICE agents on staff 24/7 at 4th Avenue Jail who will
Excellent.
interview them. And they interview every single person who comes through 4th Avenue Jail,
Perfect, thank you.
including you or I. If we were ever to be arrested, we will be asked about our nationality.
Good.
Yeah, there's no profiling in the Jeep in the jail programs. There's no need for it, nor do we condone it.
Very good.
If the person turns out to be a verified U.S. citizen or perhaps a lawful permanent resident or has some other lawful immigration status, 287G is done.
Okay.
They will continue through their normal process at the jail as would any U.S. citizen. If they do not have a legal status or they have convictions that would make them removable under immigration law despite their current status, then they will interview them a little bit closer than the initial screening. In those cases, if they prove to be a removable foreign-born national under immigration law, they will place a detainer on them. If they bond out or they're otherwise released from the facility here, they will then be transported over to ICE, Enforcement Removal Operations Office, and the ICE agents will further process them and review their cases. They will determine on a case-by-case basis whether they meet the current priorities and whether or not their past convictions are sufficient to charge them as removable. And that's basically what the program does. The steering committee, which I don't particularly care for this name, what this really is a public outreach more so than a steering committee. But the mission of it is to improve the program oversight and direction, identify any issues or concerns regarding immigration enforcement activities, increase our transparency, and offer community stakeholders, such as yourselves or the community at large, opportunities to communicate community-level perspectives, any concerns or anything like that about the program. The vision of the steering committee is to create safer communities and improve national security by enhancing ICE's ability to identify and remove criminal aliens by gaining an independent community-level perspective on 287G operations. We've all heard in recent news of, for instance, a shooting that occurred up in San Francisco. Basically what this program helps us do is it ensures that people that we've already arrested for some sort of a crime in the community of Mesa, we at least have the opportunity to identify whether or not they have the legal right to be here and not to unknowingly release them and to have something happen and have it come back later that we had the opportunity to take an action and we failed to do so.
And I'm sure you're aware we've had 2 terrible tragedies here in Mesa related to this, and we're just heartsick over it. So whatever we can do to help support where that doesn't happen again would be greatly appreciated. Vice Mayor.
Just a question, Chief. Approximately how many of our personnel have gone through the training? And again, after several years' experience, what's the department's, what's your reaction to it? Has it worked well in your perspective?
When we first rolled out the program, we worked our way up to 10 of our detention staff actually went to South Carolina for the full training program. And over time, we are down to usually about the 4 to 5 range with current staffing that are trained in the 287G. So with that, it gives us the ability to go through each of the arrests, go through the necessary protocols as well. And we have a relationship in terms of if we run into any issue that we contact ICE and really our detainers really from our agency are rather small. We may average somewhere between 17 to 20 in a year of the misdemeanor type crimes that we're referring to. The rest of the assessments are done at 4th Avenue on felony charges, so we don't necessarily know what those numbers are particularly. From our perspective, we find it to be effective because it's a standard protocol. It's done for everyone that gets booked into our jail, so that it's done uniformly and it's done consistently. And I think from our measure, that's very critical for the program.
Thanks. And a follow-up, do we do DUIs then? Do those fall under misdemeanor, or are those under the more serious offenses?
It varies. Some DUIs are misdemeanors, and sometimes if they are booked, then they would go through the protocol in Mason in terms of the questioning. Some of them are felonies, and if they're booked into the county jail, then they would go to 4th Avenue, and they would go through that same process that's done by the ICE officials at 4th Avenue. So some are misdemeanors and some are felonies, so it just depends which process they would go through.
Understand. Thank you. Please continue. Or we're pretty much covered everything?
Yes, sir, but I would like, if you would, at some point, too, be on the council, if there's anyone from the community that's at the meeting that has any questions, we would love to answer those as well.
Okay. We haven't, I don't know if there's some here in the audience that are with us, and we appreciate the outreach that you're doing. I know it is a hot topic here in the community and of much debate, but again, just speaking for myself, anything we can do to make this work better, to get the criminal individual that might prey or cause a tragedy here in the community, we're ready and willing to do whatever we can to support. With all the rhetoric and the politics and everything, I have found personally, and this is my quick little soapbox, that it is almost universal that everybody agrees to get the dangerous criminal immigrant off the street. So if we can at least just start there and cut all the rest of the rhetoric out. But Vice Mayor, thanks, save me here.
Thank you, Mr. Chairman. Just raised a question with all the MOAs expiring next June. Obviously, we need to be looking towards a renewal. Do you anticipate any major changes in the program, any major changes in the terms and conditions of the MOAs, either on the part of the local agency or on the part of ICE?
I don't anticipate at this point any major changes to it. I suspect at this point that we'll probably be looking at around the first of the year for ICE headquarters to start coming out with the templates for the new agreements. Really, the only thing
that'll come back to us, I suppose, as a council from the police department.
I believe they're routed through the police chief.
The renewals of the MOA, unless there's considerable change to any of the terms, are usually signed by the chief of police.
Okay.
And also by, as you said, at headquarters in Washington as well. But if there's anything of significant alteration or change to that, that would be something we would want to bring forward if it fundamentally changes what our agreements have been in the past.
Thank you.
Okay, wonderful. Thank you, Professor. Councilmember, anything? Well, thank you so much. We would say that you are available for any contact if there are folks here in the audience that would like to visit with you and get more information. But thank you for taking the time and getting us updated, and we appreciate the police department and the cooperation we have with you. Thank you, sir.
Thank you very much.
Thank you, Chief.
Thank you.
Wonderful. Next item is to hear a presentation and discuss the collaborative efforts of the police, fire, and medical departments' peer support teams in addressing post-traumatic stress disorder, and also to discuss the workers' compensation program. So we'd like to invite up the folks that are involved with that.
Afternoon.
Good afternoon.
So as you introduced, this is both fire and medical and PD collaborative efforts for behavioral health, as we're pulling up our PowerPoint real quick. Also working with HR in our workman's comp arena. So we'll try and keep it brief, but for
Feel
most
free
of
to
you,
introduce yourselves.
I'm sorry,
still,
I should introduce myself. My name is Dale Kroger with Mesa Fire and Medical. Been captain there 22 years.
Detective Vicki Hickson, Mesa PD, 18 years on, and I am the coordinator for our peer team.
Okay, excellent.
And I'm Gary Manning with Human Resources.
Excellent, thank you.
Now that we have the introductions, to introduce what we're doing here is just that. It's that collaborative effort. About 3 years ago, most of you probably already know this, but about 3 years ago, both police and fire got together and started working together collaboratively with our peer teams. And we started a City of Mesa public safety peer team. I would say that probably Chief Milstead was the one who pushed us together, but it's definitely been Chief Beck and Chief Mesa that have kind of let us run with this and take it to where we're at now. With that being said, the focus on it for us lately has been our PTSD, our cumulative stress, our compassion fatigue, all the things that we find in the public safety world. And really what we've been trying to do in this partnership is develop better programs, really more comprehensive programs to both identify, treat, and support these issues as they come up and prior to them coming up. So one of the big efforts that we've pushed through lately is more preventative measures. How can we help our individuals to not prevent them, but alleviate some of the stress that they may find themselves in that can lead to that PTSD or stress injury down the road? So one of the things that we want to do is make sure that we're assessing them in the right ways.
So one of the ways we're doing that is looking at who's coming into our organization. Recent years, we've been hiring more military veterans. We have millenniums, Generation Xers, baby boomers coming in with their own background, their own histories, their own experiences. And how are we addressing those? How are we trying to meet them? One of the ways we're looking at is wellness checks, mental health preparedness. The fire medical units are using their annual assessments, health assessments, to kind of check in with folks. The police department has utilized their annual mandatory training to provide a more up-to-date mental health awareness. And our peer team. Not only have we expanded our peer team and expanded our training, we've also gone out and utilized community programs that existed out there that we didn't know about. And so one of the ways that we are giving back is getting out to our folks and making sure they know how to access our team and also explain and provide them those available resources should they need them. Environmental support, the biggest probably challenge for us is changing the culture, that it's okay to reach out and ask for help. And then preparedness. How do we prepare, who do we prepare, and what do we prepare them with? Essentially, we want to prepare everyone. Currently, our current funding is allowing us to focus some extra resiliency skills training with our new recruits, kind of starting from the bottom. And then with our current efforts, as we continue, the goal is to expand that training into our veteran officers and supervisors so we can eventually get to everyone. And what do we prepare them with? Basically, we want to prepare them with tools to help our first responders successfully retire after 20, 25 years, especially with the current stressors, how to deal with them, how to be healthy, basically, so you can make that end of that career. So our next one would be response and how we're looking into that.
So we talked about the preparation side of it, and the response side is what we're good at. That's what we do as law enforcement and firefighters, is we respond to emergencies. So what we tried to do is create something where we're less responding to emergencies, but responding to potential emergencies and getting things dealt with early on. So the peer support team, and how do we do that? Again, by combining the efforts of the two teams, we didn't just double the size of our team, we really quadrupled the size of our team, because we were definitely heavy in one area for fire, then PD wasn't, and vice versa for PD. So it really expanded the team quite a bit. Gary's going to go through a flow chart in a little bit that will show some of those responses. Social support. That's one of the things that we teach when we talk about teaching these tools in the resiliency toolbox is, do our members have the tools outside of the police and fire department? We know that we're not going to provide everything in the city of Mesa to keep us strong and healthy. Do they have those other outside tools? Their families, their religious groups or church groups? Do they have those other networks that they rely on? And then family support. Family support has been a big part of this for us. And there's really two ways that we've been really trying to manage this. The fire department, for the last 6 years, every other year, we host a family support day. And we invite spouses, we invite children, we invite partners. And we go through everything from behavioral health to finances to nutrition, eating right, you name it. We really let the groups help us decide what we're going to present on next. PD has now stepped in, and they're doing their first one in February, and hopefully we can start doing these collaboratively and doing them maybe every year instead of every other year. But the biggest part of the family support for us is when we're talking about our members and we're talking about PTSD and stress management. If we don't get the family involved, then the family doesn't know what that individual may need long term. So in a nutshell, if you take somebody who has a substance abuse problem and they go through EAP or they come through the peer team and they get assistance, then we turn them back to a house where somebody there is using or an alcoholic. It really doesn't help the process long term, the success rate, especially in the recovery. And that's our next big part. Really, how do we recover? How do we help people come back from these injuries? And that's really what we look at these PTSD, these behavioral health as a stress injury. Long-term aftercare. What do we have in place, not just to get them through the next few days or the next few months, but how do we get them back on the job and through a successful 25-year career? How do we get their family back on track and those other things? These things aren't being done just in conjunction with members of the peer team from police and fire, but this is us bringing in professionals to help us with this. Organizational reset, that's really just us working with human resource, working with the fire administration or police chiefs to decide, did we do the right thing for these individuals? Everyone is going to be different. Peer support, as most of you know, our peer members are volunteers. These are men and women on both police and fire. They don't get paid any extra money, don't get any extra overtime. They do a lot of extra training and provide a lot of extra resources. So really keeping them healthy and strong is a big part of it. So we've tried to create programs specific to their well-being so that they can go out and help our membership. Future needs. We always throw in something to talk about what it is that we need to get better at. We talked early about a comprehensive program. I think we're on the way there, but we still need additional training, additional awareness. How do we get the education component out there? Vicki talked about the environmental support. How do we change the culture so that a police officer or a firefighter can say, I need help before they hit crisis? So that's a big part of this. Resources are always going to change, depending on whatever the new main stressor is. We just went through a recession a few years back. That had a big stress component to it. You know, marital stress, financial stress, children, all those things, in addition to what it is that we experience every day on the job. So for me, it really is summarized with training. Training, whether it's for our membership, for our leadership, or for our peer team.
The last two slides we have for you really are flow charts that we've been working on for the last couple of months that really provide a high-level overview of a couple of processes we have in place now. And this information really complements what really we've already been providing you here today. The first one is really referred to as just preventive measures, because this flow chart really identifies the resources and the processes that are currently in place now to help mitigate cases of PTSD and perhaps eventually avoid them altogether. So just as a starting point with this particular slide, we started with the critical incident or the traumatic event itself. So the first responder really goes to a call and they are exposed to a critical incident. Could be a shooting, could be a child drowning, or something similar. Following that in the flow chart is where really the fire and PD peer support teams are mobilized and they become effective right away. And those peer support team members are specially trained in how to identify and provide specific assistance to our first responders that may be suffering or have some issues that may later arise into PTSD. Those peer support team members, when appropriate, depending on the gravity of the call, may actually go on scene and provide the first responder with some specific help at that time. If not on scene, certainly shortly thereafter is when that first contact is made to make sure that they're getting the help and the support they need. The next oval shape really talks about, at some point in this process, we do ask supervisors to document the incident, and they provide that safety incident form to the safety services team, just so that at some later date we know when it occurred and what happened at that time. The next part of the major part of that process, yeah, John.
Chair, if I may.
Yes, please.
Gary, do we ever go back when we have cases of PTSD that progress through the system and look to see if we got that supervisors incident report to see if we identified it early on? Is there ever a truing up to see if we actually caught the incident when we should have, or if we missed it?
Yeah, both the PD and fire are pretty good at documenting those incidents and submitting them to safety services. And that really does become some critical information later on down the road, should there be a workers' compensation case filed, or perhaps the individual goes to the Public Safety Review Board. So they're pretty good about submitting that.
That's our biggest problem with this diagram, is that it sets up very nicely when we know there's a major incident. When somebody is involved in a shooting or somebody goes to a double drowning, we can say, here's a major incident, let's get involved. Where this is harder is when we have that career of accumulative stress, or we have somebody who gets to a point where they're not really sure what the activating trigger was, but now they're at a place where they're critical, is where do they fit in? Unfortunately for us, that doesn't always happen with that traumatic event. So sometimes we have to start this process midway through and, just like you said, try and backtrack. And that's been where we've had to work the most with Gary and Nitra and the other city safety services group, to really try and better that process, because it's not a good process now. It's just tough.
And is there training out there for our supervisors to notice that cumulative stress? I mean, that's not as simple as saying, hey, we had a high-profile shooting, we know it's there. This is a little bit more subtle.
I would like to sit up here and say that we've got a handle on that, but we're working to it. Whenever we talk about training and education, we talk about dollars. We talk about, do we have the finances to bring people in and train them? Do we have the finances to bring people in and educate them? I don't often say that PD is 2 steps ahead of us, but when it comes to moving personnel around, they have the ability to do it at a much lower cost than the fire department does. So we're working on creating a training module for PD that will probably move forward quicker than it will for fire, only because of cost. What we've done on the fire side is we've done a baseline assessment of everybody in the organization. PD is working on that same assessment now, and then we can start interjecting the littlest bits of training at any and every opportunity we can.
On the PD side, if I can add, sir, recognizing this issue, we actually expanded our full-time peer coordinator. I was alone for the last year, and seeing that this was something that we definitely needed to work on, both on the front end on the education, but also the follow-through, kind of advocating for the employee along the process. And we have added another full-time employee who's part of the peer team, but his majority of his duties is exactly that, is getting in from the ground up, from notification, and kind of not just following the process to ensure that we have all the documentation, but also get in contact with the employee and kind of prepare them, if you will, and guide them through the process. And that's been probably this year's goal, is working toward that. So that's going to be great.
So once the traumatic event has taken place, the peer support team is mobilized. There's some documentation about the incident itself. The next major step is that critical incident stress management debrief. And this is where all of the staff members that have been involved in that come together in a facilitated process. They talk about what happened. They talk about the processes that were used. Where were we successful? Where were we not successful? And certainly reminds all of the staff involved as to the resources that may be available to them. And that occurs just as quickly after the incident as is feasible. Next, after that, really the peer support team is not through. This is when really the work begins, because they make regular and frequent contact with the staff members and the first responders, really touching base with them, making sure that they're doing well, providing them any guidance that they might need with any counseling that might be available for them. But really that's an opportunity really to touch base and to assess whether or not they're in need of some further assistance. If it occurs that the peer support team member really recognizes that there's a first responder that's really suffering in that, we do have some professional treatment options available. Probably for a little over a year now, we have on contract Dr. Robbie Adler-Tapia, who is well known for her PTSD expertise in treating individuals who have been suffering with that. We also, just so you know, as part of our citywide benefits contract, we have a vendor called ComPsych, who also can provide that kind of mental health training and assistance. And we have a kickoff implementation meeting on September 17th, and we're going to talk to them specifically about the resources that they have available in their network for mental health providers that are specifically trained in providing that kind of PTSD related assistance. And then the last oval, of course, is PD and fire are providing ongoing training about resiliency and what to watch for and how to prepare for those kinds of events. So that's really just a high-level overview of the steps that are involved in those preventive measures that sort of supplements the information that we just provided to you.
I think in a perfect world, we would add that oval to wherever you see a arrow in this process, that last oval.
Really, the last slide is just to provide you a very high-level overview about the workers' compensation process. Just as a reminder, the city is both self-funded and self-administered in workers' compensation. And if I may, we certainly recognize that workers' compensation is often not viewed terribly favorably. That is seen as a very bureaucratic, sometimes a very unfriendly process. We've been recognizing that. We've been trying to make some great strides to make that as a positive experience as we can, reaching out to the employees and make sure that they understand the processes and the steps that are involved in that. Keeping in mind that probably, as you know, workers' compensation is very regulatory, and Vice Mayor Kavanaugh could probably tell you better than I how statutorily driven that process is. So at the beginning of this really is a visit from the injured worker to a Banner occupational health facility. That really starts the process. That means an injured worker says, I need some help. I would like to file a workers' compensation claim. They go to a Banner Occ Health facility. They get their treatment, and then Banner files the necessary regulatory paperwork to the Industrial Commission. The Industrial Commission evaluates that, and the Industrial Commission then sends to the City of Mesa a notice that the claim has been filed. Once City of Mesa receives that notice, by statute, we have 21 days to make a determination of compensability. In most instances, the 21 days is doable in receiving the types of medical documentation that is needed to make that determination. In PTSD-related cases, because they are so complex, because there's lots of medical information that has to be received, and the individual is sent out for an IME, we oftentimes don't make the 21 days. And as a result of that, the city then is forced to initially deny the claim. And I think sometimes that's where our first responders feel like they've been abandoned. So we're reaching out to them and we're sharing with them that we're not turning our backs on you. We recognize that you're suffering. It's just that by statute, we only have 21 days to make a determination. We also tell them that between that 21st day and they have another 90 days that they can appeal that determination to the Industrial Commission, we're going to continue to evaluate that case. We're going to continue to get that medical information in, and at any given time, should we receive that IME evaluation and it appears as though that it's a claim that should be compensable, we reverse and we accept that claim. So we're reaching out. We're trying to have more conversation either over the phone or some face-to-face dialogue with those individuals' workers' comp.
Question, Councilmember?
And thank you, Mr. Chairman. Gary, I have a quick question. Would it be possible to do an RFQ for a doctor to do the IMEs for the first responders within that 21 days?
If I understand it, send out some sort of an RFQ that would allow us to contract with a doctor that could perform that?
Doctors, so that when they do have that 21 days, they're gathering the paperwork from their other doctors to provide it. But if we had an IME that we contracted with, so that they could go to that independent person to gather that evaluation, would that be possible?
It would be possible. We can certainly look into that. The other thing for you to keep in mind is we already have a list of IME-related doctors that we have contracted with that we can send individuals out to, depending on whether it's neurological, whether it's orthopedic, whatever the case might be. The key is trying to get all of the medical information from their personal primary care physicians first. And once we've got all of that information is then sent to the IME, because whoever that person is needs to have all of the information when they conduct that independent medical examination. Then once they have all of that, they do their own assessment, and then they send all of that information back to us. It takes a long time sometimes to schedule those IMEs. We try to work with the employees. to schedule it when it meets their time frame. But of course, sometimes it's the doctor, him or herself, that schedule that as well. But we can certainly look into ways maybe to streamline it and get that IME scheduled a little quicker within that 21 days.
Please.
Some additional questions. I know that the last thing that someone wants to do when they have to go on extended leave of absence because of PTSD or whatever the reason might be is to try and work with many different people in many different departments to make sure that everything is signed off and correct. What ideas from an HR perspective and both from PD and fire, do you have that we can centralize and streamline that process to make it more efficient?
Yeah, we're taking a look at that as well. When a claim comes in, the very first contact that's made to the employee is from the workers' comp area, saying we've received your claim. Here's the process that we're going to be working with. Here's all the paperwork and the medical documentation that we're going to need to be able to get through that claim. They try to make some regular contact with them about that. On the benefit side of the house, there's not a whole lot of contact that has to be made there because this claim does not go through the benefits office. It does not go through the benefits trust fund. All of those expenses are paid through the workers' comp trust fund. So benefits really by and large is out of the loop. And we encourage those claims not to be paid through the benefit trust fund, but to have it paid through the workers' comp trust fund. So we do try to coordinate, particularly when we're working with doctors, reaching out to the doctors as well, trying to get that medical information. But it's fairly self-contained in the workers' comp side of the house, all of the information that they need to be able to get us the information so that we can make a compensability determination.
From the fire side, we've actually made huge strides in this area. And PD is now doing the same. They just got a full-time position under Peer to do that. But we have a wellness director, wellness coordinator, and part of their job is to, quote unquote, hold your hand through that process, starting from the documentation of the paperwork all the way through the process. And that individual also works with the labor groups. That individual works with the personal docs or specialty docs that may be working with that member. It hasn't been as streamlined for our stress-related injuries or our PTSD claims, but we've done such a great job, I feel like, on our industrial injuries or our physical injuries that we're really trying to push that line to the stress injury side. And it's made a big difference for us, big difference.
I'm really glad to hear that because I think that's an excellent thing for both fire and medical and police to take advantage of that wellness position so that they can be there for that person. Ideally, what I'd like to see for HR staff is when it's PD specific claims and other delicate claims like this, there is one person that is dedicated to that claim and that individual that can see them through the entire process, so it's more personalized. Ideally, that person would be a case manager or someone that would be with them every step of the way so that they can understand what is going on, so that they can have that personal touch. I know that we reach out by sending letters and phone calls, but far too often people that do have PTSD, when they get the rejection notice, all they see is, we feel that you're not suffering. And I know that we do outreach. However, I think having someone assigned specifically for these type of claims would do a great benefit for the first responders.
Yeah, we can certainly do that. And I don't disagree with you that when we're dealing with employees that are suffering to a certain extent some mental health injuries, sometimes it's easier if we have just one single point of contact, one familiar, friendly voice that they can reach out to and get that kind of information. We'll certainly look into that and see how quickly we could implement something like that.
Thank you.
Yes, ma'am. You want to add something?
Good afternoon. My name is Nitra Hawkins. I'm the safety administrator, so I oversee the workers' comp. And I just wanted to add to Gary's statement is we do have 2 workers' compensation representatives, and they are assigned by claimant's last name. And so if someone A through L has a PTSD claim or any type of claim, that one workers' compensation representative will work through them throughout the entire process. Now, the only time that we cannot work directly with the claimant is if they have an attorney. But again, it's the representative and the attorney and the claimant that have to have that conversation. But we always have that one person assigned to those individual claims.
I do appreciate that clarification. I just think that these claims are so special, and especially for our first responders, that it should be another individual that just doesn't happen to cover A through L and the other half of the alphabet for other workers' comp claims. Especially, our PTSD deserves special attention, especially for our first responders who put their selves on the life on the line every single day for the citizens in our community.
We agree. We'll look into that for you.
Vice Mayor has some things. Thank you.
I want to compliment you on the team approach and the progress. About 4 years ago, the members of the Public Safety Committee began talking about this with the city manager's office and the police chief and the fire chief due to input we'd had from our employee organizations. And I think Mesa is taking a very good approach about it, a good interdisciplinary approach. And not to be the historian, but I think here I've got more experience than anybody on this issue in dealing with Mesa, because I used to be chief counsel at the Industrial Commission, so I did the regulatory side. And then for 5 years, I represented Mesa defending worker comp cases from 89 to 94. And very interesting at that time, during all that 5-year period of time, I never got a PTSD case to defend. I don't think any were filed because of the culture at the time. Just firefighters, police officers simply wouldn't do it because they were embarrassed, and the culture within the department was very rejecting of it. And it's been a real cultural shift in recent years. When I left council, I started doing Mesa cases again, but I've done police and fire cases throughout my 27 years as an attorney. And one of the key reasons Mesa does a better job of processing is that it processes claims in-house. You have wonderful claims representatives who care about the fact that these are their coworkers that they are managing the claim for, and that's a difference. I have cases against many other Valley cities who are self-insured, but they use third-party administrators to process the claims. And I will tell you, there's a definite bias against public safety personnel by those third-party administrators. All you need to do is look at the giant investigation in Phoenix that is still kind of perambulating along against a third-party administrator that we won't name, that has changed its names twice to try to escape the reputation, because there is a bias against it. And the sad thing is many of my colleagues in the defense industry have that same bias, cynicism, and are jaded, and we use them. And so what I have stressed in all my years on council is that you need to rotate your defense attorneys periodically, because even they can be great attorneys, great people, but there is a bias among them because they feel that public safety personnel have an entitlement mentality. To some extent, that's true at times, I will admit. On cases, public safety personnel are very difficult to represent as an attorney because of their expectations. But I think that's one of the things that you can do, at least within the community, is to rotate the attorneys that you use so that you at least have some fresh faces dealing with Mesa personnel, dealing with Mesa claims reps, and be aware of that cynicism, because it truly does permeate cities who have carriers, and particularly cities who use third-party administrators. And I served as 8 years as chair of the Public Safety Retirement Committee, and I saw the increasing number of cases go through, but I think Mesa's done a good job in picking fair doctors to evaluate the cases. But what you're coming up with now, this interdisciplinary approach, really in the long run serves great purposes, because I think you're going to have many more outcomes where the firefighter or police officer goes back on the job. Because in years past, the departments wanted to throw those people away. The culture was, I don't want them in my department. I don't want them in my crew. And I think that's changed through education of your supervisors and working together. I think really what you have for cities as a role model is really a great template on how to handle cases better. And so I very much want to compliment you on the approach that you have taken. Thank you.
Thank you, Vice Mayor.
Thank you.
I also want to thank the departments and HR for the hard work that you guys have done. Thank you, Gary. Thank you, Chief Mesa. Thank you, Chief Beck, and to all of your staff members who worked very hard and diligently on this effort. PTSD affects everybody regardless if they want to admit it or not, and it's especially in our first responders because they do have that mentality of I'm Superman or Superwoman and it shouldn't affect me, but at some level it does. And we invest a lot of time, energy, and money in our employees to get them trained, to get them equipped to deal with these issues. And we invest far too much in them to lose them over things that it can be treated. And PTSD is treatable, and you can manage it and still live with it. It's just something that has to be recognized. I want to thank the Mesa Police Association and Chief Mesa especially for their work with the documentary Code 9. I had the opportunity to go watch it, and they did workshops. It was a very touching and moving documentary that put a human face on PTSD for first responders that a lot of people don't have the opportunity to see, and they don't understand what those people are feeling and what they're going through. It's something that really does motivate us from a policymaker that we want to do the very best for our first responders who are out there every single day fighting for us, and making sure that they have the best health care possible and the best health care provided, and that they have the knowledge that we are here to support them. So thank you for the work that you do.
Wonderful. Thank you all. We appreciate it. Okay. Our next item is to hear a presentation, discuss updates on ambulance service levels and the Centers for Medicare and Medicaid Healthcare Innovation Grant. We're kind of on a tight timeline, but this is exciting, positive news.
Chairman Finter, Vice Mayor Kavanaugh, Councilmember Glover, thank you very much for having us. We'll be very brief on this. Just a couple updates. My name is Mary Camelli. I'm an Assistant Chief at the Mesa Fire Department, along with Deputy Chief Steve Ward, who is our Program Manager, and of course, Fire Chief Harry Beck. We'll start with the ambulance situation. First of all, we really want to thank Mayor Council, City Manager's Office for the support in letting us apply for a CON application. We did get awarded the CON July 23rd, which was very exciting for us, for the City of Mesa. But that wasn't without hard work from legal, Alfred and Jackie, and along with Jason Taylor, who did a lot of the work to really get us going on that. So having that, we're going to be allowed to bill for some of the service we are doing. We are currently tracking all of our data with the ambulances. Right now, we're running about three to four times a month. We're going on what's called low ambo, and that means the ambulances are down to 5 ambulances. When that happens, we put 2 rescues into service. We staff 2 of our rescues, and we've transported two a month since June, so 6 so far, 6 transports. We're in the process of applying for Medicare application. That's about 4 weeks out. Once that application is accepted, we'll be allowed to bill for our services. So the billing is we're projecting about 4 weeks out. So that's where we are with the ambulance situation. And now for the grant, exciting stuff. We're one little program away from being completely, fully functional in the grant, and Chief Ward's going to go over that. But some interesting information with the grant is right now we have all of our CCUs operational, our CCS is operational. The CCUs in Mesa average about 8 calls a day, and the behavioral units, the CCSs, average about 3 to 4. The amazing thing about both of these units are that the CCU is about 60% diversion. That means we're diverting about 60% of these patients from going to the ER, and the behavioral units are about 70 to 75% diversion, which really adds up. And now I'll have Chief Ward go over some of the programs, how they're in place.
Thank you. Good afternoon. So I'm proud to announce that as of tomorrow, that is our first anniversary of our first year anniversary of our award notification. And with that being said, as Chief Camelli noted, that operationally all the elements outlined in the Innovation Award Grant have been implemented except for one, and I'll touch on that, which includes those 6 operational units. It also includes a nurse triage program that we have up and running in the communication center, and it also includes our centralized medical direction. So the one program that we still are just finishing up and working on is a follow-up program, a high-risk discharge follow-up program that we're going to be running in conjunction with our partner, Mountain Vista Medical Center, and that focuses on congestive heart failure patients who are being discharged that are eligible for home health care. However, home health care usually touches those patients in about a 72-hour after discharge window, and research shows that if we can touch them within that 72 hours, that we can really reduce the amount of those patients that end up getting readmitted into the emergency department or into the ICU. And so our focus is in that 72 hours, which one of our community care units will go out and visit one of those patients and do some med reconciliations and that type of stuff. And that is going to be a pilot program that we're under with our partner, Memphis Medical Center. Right now, we're just finishing up the workflow methodology, and our target date is September 15th for implementation. So the status of our partners at this point, it continues to be excellent. All of our private partners have been very supportive and very involved in all of our programs, and they've just been outstanding. So I'm happy to report that. And moving forward, what we're really concentrating on right now is and focusing on the long-term financial and operational sustainability of these programs. So we're 1 year into it. We have 2 years left, and that really is a huge focus for us moving forward.
Wow. Year goes by fast. Time is flying.
It does.
Another area for update is, as you recall, when we first initiated these programs, we had what we called the TRV, or Transitional Response Unit. It was specifically designed to go on low acuity patients, non-emergency patients, to basically help them in any manner necessary. We quickly graduated into the nurse practitioner and the behavioral health specialist. Across the nation right now, based on examples like our TRV, it is evolving into a program known as community paramedicine. And it's going to be one of the baseline services of fire departments across the country. What those programs will involve is basically preventative measures, similar to the one Steve just outlined in terms of trying to catch up with patients that have been released from the hospital within 72 hours. Another program is looking at frequent callers, where we sit down with the payers as well as our own dispatch information, identify those unfortunate people who tend to need our services on a regular basis. We go out in a proactive kind of a way. We line them out in terms of what their needs are, check their surroundings, make sure they're living in a healthy atmosphere, and then connect them with the proper agencies prior to a 911 call being dispatched. So those programs are the kinds of things that are beginning to come back around as preventative measures. They don't require nurse practitioner. They don't require a specialist for crisis counseling, but they are the kinds of things that we can provide in a preventative kind of way, an EMS prevention type of program that will be, that is something that's being built out. What's unique about this is that it's the first time where it's been approached from a regional basis. We're working with Superstition Fire District as well as Queen Creek, the town of Queen Creek, and we are working with Health Choice, who is one of the insurance providers for this area. They have several thousand patients that live within the zip code areas of our 3 communities, and we're in the process right now of identifying who some of the frequent callers are with the intent of going out and being able to address those early on. In addition to that, these agreements will include some cost recovery for us, so it will be the first time for these programs to actually begin to generate some cost recovery. So these are big steps that are moving forward rather quickly, and we're also being asked to have similar discussions with Cigna, Aetna, and of course we're working on a rather significant one with Mercy Care, or Mercy Maricopa, who, as you know, is the behavioral health provider for the state. So that concludes our presentation. If there's any other questions or anything.
Okay, Councilmember.
You know, I'm really proud that Chief Camelli was able to go and present at the Arizona League of Cities and Towns about this program, and are nationally and internationally recognized for the great work that our fire department is doing. So thank you, Chief Beck, and to all of your command staff and leadership, and for your firefighters for the work that they do.
Excellent. Vice Mayor.
Thank you.
You're good. Good. Thank you very much. We appreciate it. You guys are amazing. Okay. Next item is to, give me one moment here, I'll get out of the presentation. Here, presentation, discuss and provide a recommendation for police-related towing service contracts. I'd like to invite up our staff. I think this is just going to be a brief overview of where we're at and
Asking for our recommendation.
yeah, finding out.
Good morning, or afternoon, whatever it is. I'm a little lost now. It's quite the morning. All right.
Yes.
Change of roles threw me for a second there. We're here today to talk about the police towing services and the term contract. As was alluded to, this will be a brief overview kind of where we left off last time we came to council. And really our goal today is to seek direction as to what you would like us to investigate, what would you like us to look at plans so that we can bring back a program to public safety to forward to the whole council. As a brief history from before I go on to what our current contract is, we left off with an entirely different council. We have a new council that we have not had any chance to win. We also left off almost 2 years ago, so a lot of things have changed. So we definitely wanted to bring this forward in this manner so that you could provide us with some feedback as what you'd like to see us look at, so that when we bring it forward, we're not bringing you an old plan just revisited. We're bringing a plan that you can support and get behind. As you can see, and Chief, let me introduce the other members. We have Assistant Chief Dvorak, and we had the head of our purchasing department, Ed Quedens. Both of them have been integral parts of this process. They both got to go through the fun ups and downs of the towing process, and so I thought it was important that they sit up here. Did one of you guys want to go through the current contract?
That's fine.
All right, go for it.
Okay. The current contract was awarded in 2005. It was a request for proposals with 4 zones, 1 vendor per zone. The vendors were limited to 2 zones, and the vendors proposed the pricing. Where we left off in 2013 was an RFP again. 3 zones, combining the 2 zones on the east side of the city. That would balance out the tows to about 3,500 tows per year. Up to 6 vendors per zone that would be used on a rotational basis within each zone. Vendors could bid on 1 zone or all zones. That's up to them. The city would set the pricing based on a survey of the towing prices throughout the valley, with adjustments based on changes to the market, and it would be a 1-year contract with 4 one-year renewals. That would give us the chance to see how the change to a rotational system would work, and it would give us the opportunity to make a change if we needed to. The zones were divided east, west, north, south by Lindsay and Broadway in 2005, and then as we move forward in 2013, again, we combined the zones on the east half of the city.
So as you can see, when we left off, we kind of had 2 entirely different options that were available, and we were headed down the rotational aspect. There were many things that were pitched at that point in time, from 1 vendor for the entire city to bigger pools of individuals, longer contracts, a whole bunch of different things, up to and including the city owning its own tow lot. Most of those have been whittled down to what you see there. What we're looking for today is what exactly you want us to look at, so that we can then bring back accurate information. Even if we were going to bring rotational back to you, we'd have to relook at the pricing to compare where we're at and look at what types of vendors and who was using that again. We will do all of that again. We just didn't want to move forward until you gave us some idea of what you were interested in.
Okay, Vice Mayor.
Thank you. I appreciate the presentation and the comparison. I'm having flashbacks with towing. You always do. What my hope is that you can come back to the committee and the full council ultimately with something similar to what we were about ready to implement in 2013 with the rotational towing. I thought you did a lot of great work in analyzing the zones where the boundaries should be based on the calls at that time. But certainly I think obviously you've got 2 more years under your belt, and you need to look at those just to confirm whether those boundaries should remain the same or need to be adjusted a little bit. I thought you provided a lot of flexibility for a variety of people to apply for work. I love having increased competition for this kind of work. I agree you need to look at what the pricing is these days as well. And as I recall, when we concluded our discussions in 2013, at least at that point, PD had indicated to us that they would be able to administer this type of program should we move forward with it. Am I correct in that?
Right. I think we're comfortable being able to, whatever the direction is, find a way to make it happen in terms of a good administrative process. Certainly there's challenges with the rotational as well, things we can overcome. However, our task is really look at what's the best system, what we can make work based on your direction. So we certainly can do that. Our current system, we find, is certainly, we've worked out the bugs through many years. It's very smooth, and so our administration of it is rather straightforward. and has been very effective. But again, any changes to that, we certainly can make any adjustment necessary to make it work.
And if I can just follow up on that, Chief Dvorak, that's been a sticking point for me. I appreciate hearing the positive. We have great employees over there in that civilian unit that do everything from photo radar and others. What can we do? Is it software? Or is it a professional manager, whatever, that we can do to help those folks to be able to do this program well, so we serve the public well? And that's what I'm going to be looking at. But I'm very open-minded as we're proceeding with this of all the possibilities. So, just did you have anyone to respond, or?
Sure. I think from the administrative standpoint, certainly we'll have to look at adding additional person at least to help us with the rotational implementation if we went that direction, just because there is the added number of vendors that you're working with and audits to do and different billing issues. But certainly that will be part of that plan of how we will address the personnel aspect of it.
Yeah, plan for cost recovery, those kind of things along those lines. Councilmember?
I'd also like to put on the table two other options: to look under the current contract of what we have and see if that's working, and just bring that back and see if that would still function if we did that, and even looking to going to a single provider for the city, but with requirements that would make it so that it should be a fair and equitable process.
You know, just to add a little piece, you probably have more. So we've learned all these lessons. We're bruised and battered through this, and court cases and lawyers. Hopefully we've learned some great lessons, and we can figure out a way to get this as a really positive package to the full council to evaluate. And hopefully we don't repeat any mistakes and challenges. Huh?
Chairman Finter, that's one of the reasons why we will get back together. We'll bring some plans forward, and we'll bring it back to public safety, so that we have plenty of time to vet this process and to make sure that we don't make some of the mistakes that were made in the past, and that we provide a package that not only is something that police can live with, but something that's good for our citizens. So we will not rush through this process. We will make sure that we provide you with ample opportunities to see what we're doing and make sure that you're comfortable before we move forward, because we don't want to, I mean, if we move too fast, the mistakes end up taking much more time than it would if we took our time and did a full process.
And one observation, we do have folks here in the meeting with us today, I'm assuming from the industry, and if we can figure out how to reach out and make sure we have that feedback from those folks and what they think that will and won't work, I think it might head off some challenges down the road. Yes, Councilmember.
If I might make a recommendation, I think that those individuals in the industry should probably contact either PD directly, or I would say Mr. Pombier directly, because that'd be the most efficient way, since you are the ones that are putting the plans together and will be presenting us for our feedback. So I would suggest that they contact Mr. Pombier.
Chair, I would appreciate that. We have a lot of interested people, obviously, as you can tell from sitting behind me. This is a pretty packed house for public safety. And if they would like to reach out to me, we can talk about the different options. And we did a poll back in 2013, and unsurprisingly, it fell the smaller providers like the rotational options and the larger providers like the RFP options. But obviously, we will reach out again. We'll have meetings with the vendors that provide the service. We'll also meet with vendors that provide options for software on rotational towing programs, just to make sure whatever administration we come forward will match the goals and priorities that the council sets.
Wonderful. Anything else, Vice Mayor, Councilmember? Okay, wonderful. Thank you for that presentation. We appreciate it.
Very good. Thank you.
Thank you.
Thank you. If there's no other items, I'm just double checking to make sure we're not forgetting anything. We'll look at doing an adjournment. Do we have a motion? Motion and second. All in favor, please say aye. Aye. Thank you. We are adjourned.